Hi, so for today we will be talking about the first draft strategic business model of the Dgh General Hospital. So first is the key partners. So in key partners, there is a hospital supplier and so also the government support. In hospital suppliers of hospital included labor, medical equipment companies, and pharmaceutical suppliers. Meanwhile, on the government support, DGH secured full accreditation from the PhilHealth insurance company. So in the key activities, so first is the hospital medical service. So seminars for staff was undertaken, enhance technical capacity and also integrate this concept as a mantra in delivering medical services to patients. Next would be healthcare services. So private healthcare facilities were heavily used by patients because of better quality uh, medical services. So the value proposition. So first would be the hospital expansion. So proposed expansion project would provide better accommodation facilities to cater the patients from the higher income classes. So secondly, flexible healthcare services. So home healthcare services also emerge as a substitute for hospital services in the US and other highly developed countries, enabling nurses and physicians to monitor patients and provide some treatments at home rather than in the hospital. So the customer relationship room accommodation. So patients who are looking for better room accommodations and amenities. So second is the best medical doctors or physicians. So buying or should I say hiring the medical staff or practitioners to bring in patients to the hospital. Next would be the customer segments. So hospital board of director. Chairman of the board directing him to prepare all necessary courses of actions to implement a new expansion project of the hospital as soon as possible. Next would be doctors and also patients. So DGH, doctors who can attract patients and determine whether their patient needs hospital care or and to which hospital the patient goes. So next is the key resources. So organizational structure. So this would be a major change. Also led to the appointment of highly qualified personnel to lead key departments such as head of the nurse station, dietary, laboratory, medical records, excuse me, quality control and finance and accounting. Meanwhile, on the channels, we have the hospital location. Tertiary classified hospitals had the widest geographical markets, catering up to the regional areas. So they also had competitive advantage over the lower classified hospitals in terms of the number of hospital services. Next would be the cost structure. Firstly, hospital readiness. So building construction and medical equipment required substantial cash outlay for would-be new entrants. Next would be the government permit processes. So stringent regulatory requirements from DOH and PHIC also contributed to the high cost requirement for the establishment of new hospitals. Lastly would be the revenue streams. So first is the hospital's relationship with doctors. DGH was able to get a good network of noted specialists and physicians in the area. Lastly, quality medical services. Private healthcare facilities were heavily used by patients because of better quality medical services. That would be all. Thank you.